Good afternoon, everybody, and welcome to the webinar on the Course 7 topic on pathological neuron-glia interactions in neuropathic pain. My name is Catherine Brett, and I'm going to start today by giving you an introduction on how to use GoToWebinar, and then my colleague Colin Carroll, who's the scientific officer responsible for this project, is going to give a little introduction and give you some advice on how to put together a strong application. After that, Xavier Codoni of Estève will give a presentation of the topic, and at the end there'll be time for questions and answers, and Xavier and his colleague Petra and some other people are on hand to answer your questions. So, how to use GoToWebinar. At the top right hand corner of the screen you should be able to see this control panel. You can expand and minimize it, you can make it go full screen, and if you want to attract our attention you can raise and lower your hand. If you want to listen in over your computer's microphone and speakers, just select that option in the audio panel, and then if you can't hear us, make sure your speakers are switched on and do a sound check if necessary. To listen in over the phone, just select telephone and dial the numbers given. If you want numbers different to those that it comes up with automatically, just try the additional numbers link. The most important thing for a lot of you is probably asking questions, and you have two options there. If you want to type your question, send your question in writing, just type it into the questions panel and hit send. You can send questions in this way anytime during the webinar, but we'll take all the questions at the end. If you want to ask your question over the phone, then just click on the raise hand icon. So before we start, just to let you know that this webinar is being recorded and we'll be publishing it on the IMI website and the IMI YouTube channel. We'll also be publishing the presentation slides and circulating a participant list for you to help you network. So on that note, I will hand over to Colm, who will give you a little introduction to the webinar and give you some tips.
Okay, thank you very much, Catherine. As Catherine said, my name is Colin Carroll, and I'm the scientific officer here at the IMI, responsible for this neuropathic pain topic. So just to give a brief overview of what this webinar will present. So the two topic writers, as Catherine's already mentioned, will take the bulk of the webinar, where they will present the topic itself, including the need for the public-private partnership, the main objectives of the project, their suggested structure for how the project should be, what they expect from you, the public applicants, and what they will contribute as the industry participants. And finally, they will also have a slide on key deliverables. One thing that will not be presented here are rules and procedures in depth. We have had a webinar on the rules and procedures on the 20th of January. This is now on our website. The recording and slides are on our website, so please, I really suggest that you do look at this if you're thinking of applying, because this covers a lot of useful information for you. I'm going to briefly go through the submission process, just to give you some outline information, but please do look at this rules and procedures webinar for full details. So to start off, this slide explains how our typical two-stage application process works. Now, I know there's a lot of detail on here, but I think it is very important for you to understand how the IMI works, especially if you are familiar with perhaps Framework Programme 7 or Horizon 2020 program of the European Commission, because although we do adopt most of the rules from these programs, we do have some exceptions, and that's what I will highlight here. So if I start on the left under topic definition phase, this is where the topic for our calls comes from. And the way this works is that we have groups of interested industry organizations, in this case Estève and Grunenthal. These people meet in advance of the call launch, quite a bit in advance in most cases, and they discuss areas of mutual interest where they are willing to share the results of their research, share their data, and dedicate some resources, i.e. staff time, to a collaborative research project. The outcome from these meetings, where they agree all these things, is a topic text, which is what has been launched just before Christmas as this call for proposals. And that topic text contains a budget that the industry is willing to dedicate to the project. The European Commission then matches this budget, and this budget is then, the European Commission budget is then available for the publicly funded organisations. So that's the end of stage one, is the call, or sorry, the end of the topic definition stage is the call launch with an FPA budget and an IMI budget. So if we move to stage one, which is where we are at the moment, this is where we ask public consortia consisting of typically academic teams, in some cases hospitals, SMEs, regulations and so on are required. We ask these groups to form consortia to address the topic text. At this stage, these people, these consortia should account for only the public funding. Okay, so in this case, the public funding is 1.5 million euros. So in your proposal, you should account for only that 1.5 million euros. All of the submissions that we receive for in response to the topic text are then evaluated by a panel of independent experts, and only the first ranked consortium goes through to the next stage. And the next stage is when the winning applicant consortium joins with the existing industry consortium to form one single full proposal consortium, which then writes a big full proposal text, which is then also evaluated before the project launch. So I think the key point here is that at stage two, you are merging with the industry consortium. So at your stage one proposal, you should account for the fact that you will be merging with the existing industry consortium. And this may, therefore it's important that what you bring in your proposal complements what the industry is bringing. And later on in this presentation, Xavier will give an indication of what the industry is bringing as part of their contributions to the full proposal. But this detail is also in the topic text. The other important point to note here is that only the top-ranked short proposal from the stage one evaluation will go through to the next stage. And therefore, it's not just important to be, to have excellent science and a really good proposal. You have to be the top ranked. So it's quite difficult to actually to be the top ranked. So I think it's very important that you think very early about what sort of organizations you need to have in your consortium, and you spend a lot of time thinking about writing your proposal as well, because this, for us, only the first ranks will go through to the next stage. So then, once you've assembled your consortium and you want to submit a proposal, how do you go about doing it? So IMI, we use our own proposal submission tool, which is called Sophia, and you can see the web link there on the screen. So we do not use the Horizon 2020 tools. We have our own submission tool. It is very similar. If you go to the request access button, you will be sent a password, and you can use that to log on, and then you can submit your proposal. If you do have any problems using this tool, please do contact us using the help desk link, which is also on the top right of the screen there. So in that Sophia submission tool, there is you are required to submit a little bit of administrative detail on the participants in your proposal, but the bulk of your proposal is the actual 15-page written proposal, and this should fit in with the template which is provided both on our website and within the Sophia tool. This template makes sure that you include everything that you need to do to allow the evaluators to evaluate your proposal properly. So the thing to note is that the template as it stands is a template of the full proposal, and the short proposal you should submit is just the top few sections of this. So there's the cover page, the title, a list of participants, and a table of contents. And then under excellence, we are asking for details of how you address the objectives, how you relate to the call topic text, your concept and approach, and your ambition. And then under impact, we only ask you for detail of your expected impacts and how they relate to the impact in the call topic text at this stage. Okay, so just be aware of that. Those are the issues, the points we want at this stage, and also be aware of the page limit, which is 15 pages. So while you are writing your proposal, it's always a good idea to keep in mind the evaluation criteria which the expert panel will use to assess all the proposals we've received. So there are two criteria, excellence and impact. These are both weighted the same way, so that means they're equally important. Under excellence, you can see there are quite a few sub-criteria, and also under impact. And it's very important that when you are writing your short proposal, that you take account of all these sub-criteria, so that when the evaluators are evaluating your proposal against the sub-criteria, it's clear to them what you want to do under the sub-criteria, and they can do a good evaluation. The easier you make their job, the more likely you are to get a good score. Okay, so some tips on how to write a proposal which should be evaluated well. First of all, and very important, is please read all the call relevant material. So I'm assuming you've already looked at the topic text for this particular topic, but please also read the introduction to the topic text. Obviously, there are lots of other topics within the same text. If you read the overall introduction at the top, and at the bottom there is a section on conditions for this call. It's important that you read all these as well, because this sets the context for the topic. There are also various other pieces of information on our website associated to the call 7, so please also refer to those. A key point, and I think this is I've already mentioned this because it's so important, is to start forming your consortium very early. IMI calls are quite competitive. We do attract a good number of very well experienced consortia, and therefore it's quite difficult to be that one top-ranked consortium which will go through to the next phase. And I think one lesson is the earlier you start, the better chance you'll have. I'm going to move on to a slide on how to help you find your project partners towards the end, but there are things such as partner search tools, networking events, and so on, which you should use. I've already mentioned that when you are writing your proposal, please make sure you provide the reviewers with all the information they need to evaluate your proposal. The expert reviewers are instructed to only consider what is written in the proposal itself. And therefore, if there's something which you are an expert in but is not written in the proposal, they will not take that into account. So please make sure you provide the reviewers with all the information within your 15-page proposal. And then also, please also finalize and submit your proposal early. I would recommend doing it the day before. A lot of people leave this to the last minute, and therefore they are rushed and they do not get to finalize on time, or they upload a proposal which is not fully completed because they ran out of time, and therefore they will probably not be successful at the evaluation. So my recommendation is please make sure you do this the day before, and I really recommend that you go into the Sophia tool as soon as possible to see what sort of administrative detail you are required, because although this is quite easy to complete, it does take a little bit of time, and we don't want to leave that to the last minute. You can also contact us at the program office at any time. There's actually a typo in that email address. It should be imi.europath.eu. But please do contact us if there's anything you're uncertain about at infodesk@imi.europa.eu. Some common mistakes that we experience once people have submitted their proposal are that some people don't pass our admissibility or eligibility check. So the first thing we do once the proposals have been submitted and the deadline is reached is we do a quick check to make sure that you've met some of the basic criteria. So our admissibility criteria is that you have to submit by the deadline. If you've missed the deadline, that's it. You're not going to go forward to the next stage. One which people do occasionally miss out on, because this is new under Horizon 2020, is that each proposal has to have a minimum of 3 legal entities from 3 member states. So 3 member states or Horizon 2020 associated countries. And some people have made this mistake in the past of assuming that the FBA companies count under this. However, at this stage, the short proposal stage, the FBA companies are not involved. They're only involved at the next stage. So at this stage, this criterion applies to your proposal as you submitted. So please make sure you have at least 3 legal entities from at least 3 member states or associated countries. It's important under IMI to make sure that your proposal addresses everything that's in the call topic text, and you're expected to do so. So under other programs, sometimes you can select an aspect of the topic and respond to that, and you can be successful that way. For us, it doesn't work like that. You have to address everything. And if you do not address everything, you will be probably penalized for this at the evaluation. And if some other proposal does address everything, they're most likely to go ahead of you. And as I already mentioned, in the evaluation, the criterion of excellence and impact are equally weighted, so they get the same score. And therefore, it's important to address both equally. There's a temptation always to focus on this excellent science, and people can therefore spend a lot of time preparing a scientifically excellent proposal, and maybe they will score very highly in excellence. But if this proposal will not have a very high impact, they will score low in impact, and overall the score may be too low for them to proceed to the next stage. So please pay attention to impact as well as to excellence. So just to finish off then, how to find these project partners. So I think it's very important that you start with your own network of contacts. Within this topic, I think this topic is quite a focused topic, so you should be able to use your own contacts to address a lot of the issues. However, it is usually under an IMI topic, it is usually necessary to also reach out to organizations with whom you may not have collaborated with in the past. And therefore, please start early on this. You can use the participation list, which we will circulate following this webinar for those who have opted in. And these people are obviously interested in the topic, and they're naturally the people you should contact. There are a variety of partner search tools, and I would recommend that you register your own interest on these partner search tools, and also use them as tools to find other people who maybe have the expertise to complement yours, the expertise that you were missing in your consortium. So we have our own partner search tool. There's also one run by the German National Contact Point and one called Fit for Health as well. I would recommend going to all three of these. The IMI has what we call a state representative group, and these are representatives of each member state, and their role is to help applicants to have a successful application. So please contact them and say you're interested in applying for this topic, and they may be able to help you with advice or to put you in touch with other interested parties. Horizon 2020 has a similar network called the Health National Contact Points, and they have a similar role, and quite often they're the same person, but maybe you can contact them as well. And finally, use your social media. You can use our social media. We've got our LinkedIn group. Just network as much as possible. And yeah, so just to finish off then, if you do have any questions, please do contact us, infodesk@imi.europa.eu. We will answer general questions on the call for proposals and how to apply. What we do not do is we do not put people directly in contact with each other, so you should use those partner search tools for that purpose.
Thank you very much, Colm. And now I'm going to hand over to Xavier Codoni, who will present the topic.
Good afternoon. On behalf of Peter Blom-Sunkle, who is also attending the webinar, and myself, I would like to thank everyone for joining this session and for your interest in the call. Peter and I are the coordinators of the pain group at FPA, and the pain group has the goal of promoting projects in the pain field, and we are pleased to present pathological neuron-glia interactions in neuropathic pain as the first call of this group. So next slide. The identification of the mechanisms behind the development and maintenance of neuropathic pain is a huge challenge, and that has been addressed for a long time and for many research groups. Different European projects worked in the past or are working on this, but despite all the progress, the knowledge of the pathologies is still poor, and the tools for the discovery of new medicines lack of good translatability. There is a clear need for public-private collaboration in a win-win strategy where industrial partners, academic laboratories, and small, medium-sized enterprises share their expertise and capabilities for a better understanding of the molecular mechanisms of neuropathic pain. Next slide, please. So there are different ways for approaching neuropathic pain, but stem cell research is providing a plethora of possibilities in basic research, drug discovery, and therapy that we should pursue. However, the field is huge, and taking into account the budget and the time frame, we propose to focus all the work around the relationship between neurons and glial cells. Previous work demonstrated the critical role of this relationship in the generation and maintenance of neuropathic pain, but there is still a lot of work to be done. Therefore, the objectives of the full project are the characterization and identification of key mechanisms of pathological neuron-glia crosstalk involved in the development and maintenance of chronic neuropathic pain, which can be modulated and provide curative therapeutic intervention in neuropathic patients. And two, the development of robust and validated rat and human screening test systems of selected indicators of pathological neuroglia crosstalk for discovery of clinically efficacious curative analgesics. Next slide. The project should have a pre-competitive nature. The consortium, consisting of academia and small, medium-sized enterprises and the European Federation of Pharmaceutical Industries and associations members, will be working in a pre-competitive landscape. So the experience and expertise will be openly shared, the efforts combined, either in basic research and the practical tools needed to facilitate and boost drug discovery. Regular meetings and workshops will be held. Tools and results will be made available to the scientific community, and the interaction with other consortia will be actively sought to identify synergisms. Based on our experience in previous projects, either at the European or Spanish level, these are critical points for the success of the project. We have no doubt about that the applicant consortium will have the required experience and expertise, and Greenenthal and Estevia have a full commitment on the project. So what will make the difference will be our capacity to openly share and discuss any issue throughout the entire duration of the project. Next slide. Which is the expected impact on the R&D process? Well, if we are able to succeed in the project, and we are quite convinced that we will succeed, the output of the project will provide tools to accelerate research and will help to understand the role of this neuron-glia crosstalk that is involved in the neuropathic pain process. The establishment of a characterized and high-quality tools to support and facilitate exploring the role of this neuron-glia crosstalk in neuropathic pain. We expect to identify modulators of the neuron-glia interactions that can be modulated and can allow us to prepare new medicines for this pathology. We aim to establish a translational tools to support future clinical studies. Also, we deploy the synergisms across the consortium partners, and we will share pre-competitive tools within the consortium partners and the scientific community. So we would like to maximize the impact by combining multiple approaches. Again, we are fully aware that these expected impacts will be limited due to the focus approach, the time frame, and the budget we have. But the achievement of our objectives will have a great impact, and it will be the basis for future expansion of the project or for new projects to come. Next slide. As is stated in the title of this slide, this is just a suggested architecture of the project, trying to organize the different activities described in the call text in a practical, useful, and efficient way. However, depending on the applicant consortium, during the full proposal process, it may change either the number and the content of each work package. In any case, the work packages should cover the management of the project, that is, the grant administration, communication, dissemination of scientific results and research data, communication with patient organizations, sustainability plan facilitating continuation beyond the duration of the action, and so on. It also should include the in vivo part of the project, working with rat models. Again, we decide to focus in chemotherapy and in spinal nerve ligation. There are many other models of neuropathic pain, but again, we should focus. Work package 3, we consider that this is a full package, the characterization of the neuron-glia crosstalk and development of a screening assay in rat and nociceptive tissue, and so on. For package 4, 5, and 6, as is stated in the slide, but as I said, this is just a suggestion, and this will be refined with the applicant consortium. Next slide, please. Which is the contribution we would like to have from the applicant consortium? Well, based on the capabilities of Grunenthal and Stevie, we identify 3 main areas that should be covered by the applicants. That is, cell cultures, induced pluripotent stem cells, derivation, and high continence screening technology. In this respect, the applicant consortium should have the required experience and expertise for the analysis of changes of signaling pathways in vitro rat neuron-glia test systems, establishment of test systems with neurons and glia derived from human-induced pluripotent stem cells, analysis of signaling pathways in human neuroglia test systems, establish equivalent in vitro rodent and human neuroglia test systems, and the analysis of translatability between in vitro rat and human nociceptor systems. Again, the exact definition of what should be done in a very specific way, this will be defined during the full proposal process. But this is what we expect from an applicant consortium. Next slide. And what will be the contribution of these peer partners? Well, although neuropathic pain can be caused, as I said, by a wide range of insults such as chemotherapy, diabetes, viral infections and lesions, and so on. In order to remain within a realistic work frame, the industry consortium has intentionally decided to investigate chemotherapy and spinal nerve ligation-induced neuropathy. Chemotherapy and nerve ligation models are used on routine basis to test pharmacological intervention using 2 compounds acting on selecting key mechanism biomarkers, analgesic reference compounds, as well as novel drugs. And Grunenthal and Stevie have experience in those models. Moreover, the chemotherapy-induced model could allow to evaluate the same chemotherapeutic drugs in the in vitro setting, which could be an advantage for assessing the translatability of the model. Next slide, please. What is in it for you? Well, with no doubt, the knowledge about neuron-glia crosstalk will increase, and new tools will most probably be obtained. This will be transferred to the industry, which will in turn improve the drug discovery process with a more successful and translational research. If we succeed, public health system will have access to more efficacious, diverse, and even curative treatments, and so government and payers will reduce costs due to the higher efficacy treatments for patients suffering neuropathic pain, which is the ultimate goal we are trying to contribute with this project. So all the stakeholders in this slide, all the stakeholders in neuropathic pain will benefit from this project. Next slide. Having always in mind the limitations we have due to the focused approach, we will provide as key deliverables an in-depth analysis of neuron-glia crosstalk to identify key mechanisms involved in the development and maintenance of chronic neuropathic pain. We'll provide, or we'll study the development of in vitro rat screening assays based on high-content screening microscopy that resemble the in vivo situation, in particular the complex neuron-glia relationship present in neuropathic states, the identification of biomarkers of pathological neuron-glia crosstalk in rats, and the development of in vitro human screening assays based on differentiated human inducible pluripotent stem cells and high-content screening microscopy. Next slide. As already said, the FPA participants for this call are Grunenthal and Esteve. The indicative duration of the project is 36 months, and as already said too, the indicative budget is around 1,500,000 euros coming from the FPA and from the IMI. So thanks for your attention, and next slide. Questions?
Sorry, I do apologise, we were on mute there. So thank you very much, Xavier, for the presentation. So now it's time for you to ask your questions and answers. You have two options. You can write them in the questions panel and click send, and if you want to ask a question over the phone, you can click on the raise hand icon. So we have Xavier on the line. We also have Petra, who's one of the other topic writers, and Colm is here as well. So we have one question already, which is, or we have two in fact. So the first question is from Aya Calso, who asks, why was chemotherapy-induced neuropathic pain chosen as the main or only model? Chemotherapy-induced neuropathic pain is a fairly rare problem in the clinic. Other neuropathic symptoms are more of a problem.
Well, this is the selection of the neuropathic models were based on the expertise in the companies, in our expertise, and also, as I said, the chemotherapy-induced neuropathic pain. We consider this could be a very useful model because we can work either in vivo and in vitro with the same drugs. So trying to see what we observe in both settings produce the same effects on both systems.
Thank you. We have a question from Helge Johansson, which is probably more for you, Colm. Are Swiss entities eligible for this?
Okay, so just to answer the question, any organization can join an IMI consortium, no matter where they're based. However, the question is on what sort of organization is eligible for funding. And in this case, I'm afraid Swiss entities will not be eligible for funding unless they are really deemed to be essential by the evaluation panel at the stage 2 evaluation. However, having said that, we do know that in previous IMI topics, and I think this is still current in that if a Swiss organization is part of the consortium which is successful in an IMI grant agreement, then the Swiss government has agreed to fund these organizations. So that's our current understanding, but I really recommend that you check this out for yourself to ensure that you do have sufficient funding to carry out the activities, because they will normally not be reimbursed by IMI.
Thank you, Colm. We have a question from Francisco Lopez Picon. How do you see the inclusion of in vivo imaging as something that the applicant consortium could contribute to the in vivo studies of work package 2?
Well, it depends on the proposal from the academic consortia. So if the consortia provides a proposal that is clearly a complete package and includes also in vivo work, we are ready to discuss which part of the in vivo can be done by the academic group and by the industrial partner. So, in fact, our in-kind contribution, it's a main part of our in-kind contribution is the in vivo model, but this doesn't mean that an applicant consortium could not provide also in vivo experimental work.
Thank you. Another question from Helge Johansson. Are the rodent models restricted to rats only?
Yes, it is. This is mainly a practical focus issue. If we expand all what can be done in this field to other species or other animal models or so on, this will be almost impossible to accomplish with the objectives in the time frame we have and with the budget we have.
Okay. We have a question from Simona Capsoni, who says, I am the coordinator of the FP7 pain cage consortium. How do you envision the interaction with FP7 projects?
Maybe I can start with the answer to this, and Xavier and Petra can join in later. So from our point of view in the IMI, as half of our funding is public funding, it's extremely important that we take advantage of previous projects that have been funded by the European Commission or other programs, and we don't duplicate what's already been done, and therefore we encourage all our projects to collaborate as wide as possible, including with previous FP7 or Horizon 2020 projects. Now, obviously, this does depend on these other projects being willing to collaborate with the new project. Just to give you an idea of timelines for this, so the call was launched just before Christmas. This normally means that the project will launch in probably January 2017. And my understanding is that Pain Cage will probably finish in early 2017 as well. So the scope for collaborations may be, active collaborations may be limited, but building on the successes of previous consortiums is very important, and we would hope that you would be willing to collaborate with whoever happens to be in this project when it starts.
Thanks, Com. Xavier, do you want to add anything? Or Petra?
Well, in the call text there is a list of possibilities for synergism, but as Com said, it should be analyzed if there is a real possibility to collaborate. Although this will be explored. We have not started to do so, but if there is a possibility to do it, I think it makes sense to try.
Thank you.
I have also a question. Sorry.
Yes.
I have a question for Com. When is the right moment to start this context, trying to see if there is a possibility for synergism? When we have the right applicant consortia?
So my recommendation would be that so this element that we're currently under is a competitive element, and it's very important that people form their consortia aware that there's a competitive evaluation. However, at the stage 2 evaluation, it's the opportunity where there's not a competition. It's more of a binary. The evaluation is yes, no. Do you approve or do you not? And therefore, and that's also when the full project plan is being worked out, and perhaps that's the opportunity to begin to explore the collaborations with other organizations. However, you do not have any funding at that time to really go into any depth. However, this can be the plan for when the project actually launches. You can devise the plan then for when you actually do have the funding. However, we in the IMI, we expect our projects to always be on the lookout for opportunities where they can maximize the impact of their project, be it by collaborating with other people or other ways as well.
Right, thank you.
Paolo Tironi has a question. Because there is very much contribution throughout the project structure and the different work packages, is the pre-application expected to respond only in part to the call? The short answer there is no, you should respond to the whole call topic. So you can't apply for just one or two work packages. You really need to make sure that your application addresses all of the requirements as set out in the call text, because that's what the evaluators will be judging your application on. Colm, do you want to add anything?
Yeah, just to add, if you look at the bottom section of the call text for the specific topic, is where it's the suggested architecture. So obviously this is a suggestion, you can propose your own, but it's probably a good idea to stick to this guidance in some way. But where it describes each work package, there is an industry contribution, which more detail on what the FPA companies are intending to do within that work package. And there's also an expected applicant consortium contribution, what the applicant should do. And this is your guidance about how you should frame your proposal to address those points, and also how you should allow some space to accommodate what the industry is going to do as well. But as Catherine said, it's very important that you do address everything under the topic. So do address all the work packages, address the expected applicant consortium, and allow for the industry contribution at the same time.
Which is why networking is so important, to make sure that you have all the expertise that you need. We have a question from Nana Finnerup. Are you considering specific types of chemotherapeutic? If oxaliplatin, are you interested in acute neuropathy or the chronic sensory length-dependent neuropathy?
Well, we have been discussing about this, but we decide not to be site-specific in the call text. There are different possibilities. We have been working in different chemotherapy drugs, but this I think should be decided finally with the applicant consortium. So if the applicant consortium has most of the expertise in one kind of drug, then this can be discussed.
Thank you. And a follow-up question as well from Nana is, are you considering any clinical part?
Not in this project.
Not in this project.
Not right now, no. I think the project, as I said, if we succeed, and I'm quite convinced that we will succeed, this will open a lot of possibilities for future expansion or for other projects. And of course, at the end, we will go to the clinical setting, but not now.
Thank you. Okay, we don't have any questions in for now, so I will just remind you at this point that all of the information on the call, including the topic text, details of how to apply, guidance, our rules for participation, are all available on the website, and I would really strongly advise you to take the time to read through those carefully. And if you have any questions after today, get in touch with us. As Colm said, you can email us at info@imi.europa.eu. We are here to help you, so if something isn't clear, do get in touch, because it's better to get an answer than to submit something that may turn out to be wrong in some way. I don't see any more questions for now, so I will say thank you very much to Xavier for the presentation and to Petra for being on hand. Thank you to Colm as well, and to all of you for your questions and your participation, and good luck with your applications.